So this is the third video of the penile fillers series, and in this video we talk about the outcomes of the penile fillers and also any possible complications of penile fillers. So penile fillers are used to increase the girth of the penis, and in the first and the second video we have discussed in detail about the source of the hyaluronic acid and also the injection technique. So this video discusses mainly about the outcomes of the fillers. So one of the most common question the patients ask is, doc, how big can you make my penis by these fillers? So we need to be realistic, and then we usually assure the patients of increase in the penile girth by around 20 to 30%. So that's our aim in the first session. Taking more fillers may lead to some issues, so hence we restrict to 10 ml in the first session, and we usually get around 20 to 30% increase in the girth of the penis. And the post-operative care is important. We advise men not to engage in sexual intercourse for at least 3 to 4 weeks time, because we need to give time for the penile filler to completely settle in. And we apply the dressing, which can be removed on the next day at home by yourself. And if you feel any bumps or buttons sorts of thing at the place where we have given the fillers, you can press on that button or the bump, slowly gradually squeezing it towards the base of the penis so that the buttons or the bumps usually disappears. So you have some work to do after the penile fillers. Maintain a good erection, and when the penis is erect, try to smoothen the bumps whichever you come across. And no procedure is 100% safe. Yes, we, as a doctors, we want all procedures to be safe, but some rarely complications may happen, and the complications are sometimes these fillers may migrate either to the tip of the penis or towards the base of the penis, and that rarely happens. And if it happens, then sometimes we may have to do some milking procedure or squeezing technique wherein we can bring back to the normal position. And sometimes, because we have done pricks at multiple places, some mild bruising can be noticed, but that usually settles down by a week's time. Infection is very rare since we all follow the aseptic precautions, and we also add antibiotics at the end of the procedure, which you have to take for 3 to 5 days time. Painkillers are rarely required because, like I said in the previous video, there are two anesthetic agents which are given. One is the penile block, and the filler itself has some anesthetic agent, so you will hardly experience any pain. These are some of the common outcomes that we see, and most patients are quite happy after the penile fillers. And an important thing is that this is not permanent. So any fillers in the body, either on the face or anywhere in the body, the fillers, usually the life lasts around 9 months to 1 year's time. And after that, they do require repeat sessions, and many patients are quite happy with these repeat procedures as well. You may not require an entire 10 ml, maybe a 5 ml or 6 ml, depending on how much the residual penile filler is. So penile fillers are safe and has to be done by an experienced urologist or an andrologist.